Difference between femoral flossing versus a lumbar flossing?
Well, a sciatic floss, the sciatic nerve, maybe I could show best on a full model of the spine. So if you can you see this?
Yes.
Jami?
Yes.
Okay, so there's the pelvis. The lower two lumbar levels form the sciatic plexus, which goes around the sacroiliac joint. So people quite often mistake sacroiliac pain for something in the lumbar spine, perhaps a disc bulge, often mimics like sacroiliac pain. It goes behind the hip joint. And there, if I just palpate the posterior capsule of the hip joint, I get right on the sciatic nerve. If I press that, that can cause their distally radiating symptoms or mimic their back pain. You see, it's not the hip or the sacroiliac joint. It is a nerve root that is irritated higher up. And that follows down behind the hip, crosses usually at the knee, down the lateral shank, and L5 goes to the big toe, L4 goes to the little toes. So knowing that anatomy, if you can see me sitting here, a nerve floss would be, I'm going to extend my knee as I drop my head back in cervical extension. Now I flex my neck and I flex my knee and point my toes. So if you can see that, I'm actually doing this to the sciatic tract. Now, some people turn that into a stretch, which is a mistake. It is the mobilization where the therapy occurs. Now, a femoral root are these three right here, L1, 2, and 3. They form a plexus that comes down anterior down the thigh. Now, that is a little bit different. So a femoral floss is as I extend my neck, I flex my knee. So that can be done in prone lying positions, if you can imagine that.